Doctor,
Okay.
a pleasure to speak to you. How are you, sir?
Fine, thank you. Thanks very much.
So you were meant to see the Prime Minister yesterday after a lot of reports of him having an eye infection. And I'll get an update on what happened since you got that permission because it seems to be a routine occurrence where family members get permission to see the Prime Minister, and then when they get there, that permission is revoked. But before getting into that, can you maybe give the audience an update on what we know so far about Prime Minister Imran Khan?
So we actually know relatively little, unfortunately. We started hearing rumors around the weekend that there was something wrong with Imran, and that it then transpired that maybe there was something wrong with his eye. We weren't sure what it was exactly. It took some time. I think it was Wednesday, so 2 days ago, that a government spokesman confirmed that they had taken Imran to a hospital in Islamabad for some specific treatment for his eye, but no further details were provided. What is being widely quoted is that he has a condition called central retinal vein occlusion. I don't know where this information originally came from. I suspect it may have come from the hospital, but that's just conjecture. I don't know. Central retinal vein occlusion is a condition in which the main vein which drains blood from each eyeball becomes blocked. So blood is flowing into the eye but cannot flow out completely and in the normal sort of time frame, which results in congestion of the eye, increased blood stasis in the eye, blood being stagnant in the eye, which can lead to bleeding, blurring of vision, pain in the eye, and eventually even visual loss of some degree. So this is quite a serious condition. If this is what he has, it is quite a serious condition. It does require urgent treatment by an ophthalmologist, and specifically by an ophthalmologist or an eye specialist who has further subspecialty training and experience in diseases of the retina. So, every ophthalmologist may not necessarily be able to treat this. Again, we don't know what treatment he had at the hospital that he went to, but normally the treatment that's provided for this is injections of a particular kind of drug into the eyeball to try and prevent new vessel formation and to try and stop the bleeding in the eye. Sometimes steroids are given as well to reduce swelling and edema. And occasionally laser treatment is also required. So it is a multi-pronged approach, and it's quite common to need more than one round of treatment. So it's likely that he will need to have further bouts of treatment over the next few months, and it is 2 to 3 years at a time sometimes. It is treatment that needs to be carried out in a hospital, and it isn't something that could be administered in jail.
What would cause that condition if CRVO, central retinal vein occlusion, is the condition he has?
So in many cases, no cause is found. Tends to occur more in older patients. And so there may be some age-related phenomena that we're not quite clear on. But in a number of cases, there is an underlying medical condition which needs to be treated. This includes things like high blood pressure, hardening of the arteries, a high cholesterol or other lipids in the bloodstream, some autoimmune conditions and diabetes, and also hypercoagulable states, which means that in some patients, in some situations, the blood becomes more sticky than normal and tends to clot for no apparent reason in the wrong place. So, if one has a cut or an injury, obviously one bleeds and eventually it clots. But sometimes within blood vessels where blood is supposed to be flowing, it can start to clot within the vessels. So that is also a condition which can occur. All of these need investigation apart from whatever treatment is provided for the acute illness in the eye, so that if he does have an underlying condition like that, then those can be treated as well. I would say that I've seen him over the years for a number of conditions, but I've also visited him in jail 5 or 6 times and examined him medically. The last of these visits was in November 2024, so it's about 14 months now. But he certainly had no other major medical illnesses up until the last time I saw him. None of the conditions that I just described.
If this condition is not treated, how long before he starts experiencing the worst case scenario, which is partial vision loss, and could it lead to full vision loss if completely not treated for a long period of time?
Yes, in the worst case scenario, it can lead to significant visual loss. I would hope that because, symptoms do tend to occur quite acutely, and from all accounts, again, from what the government has said and from what we're hearing in terms of rumors, it does seem that he's had some treatment, and one would hope that he's had the appropriate treatment. But again, a word of caution that we are quite concerned that he needs to be seen by a particular kind of ophthalmologist, someone who has training and experience in diseases of the retina. We're not sure if that has been the case or not. So, everyone needs optimal healthcare, obviously, but we are concerned that he in particular should be given all that is due, and that, if he needs specialist care, that it should be provided. There are physicians appropriately trained to treat this kind of thing in the city of Islamabad, and we have a colleague of mine who's trained in this specialty from Lahore went with me yesterday to the jail, but we didn't get in. But we have also provided details of people in Islamabad who can treat this condition there to the authorities and to the legal team.
So you said you went with your colleague there to see Prime Minister Imran Khan. Were you initially granted permission to see him, and what happened?
Okay, so no, we were not, as far as I'm aware, we were not granted permission, but the legal team felt that there was a strong likelihood that permission would be forthcoming during the course of the evening. And so we set off without having that permission in hand. But, as I said, I've visited Imran several times in prison, and it's often the case that you're never entirely sure when you leave as to whether you'll manage to get in or not. There are time restrictions, there are various other things. So it's always a bit up in the air when you go. You're never entirely sure that you'll get in. So it was a similar situation yesterday. And because of the acuteness of the situation, because his health was, we were concerned about his health, and we wanted that a specialist should see him. So we decided to take that chance and see if we could get in. We got there about 11 o'clock at night, and there were a number of people outside, including members of the legal team. And we waited about an hour and a quarter. I think sometime after midnight, it became apparent that we weren't going to get permission. So we left, went to Islamabad. We were told that this morning they would be going to the courts to see if we could get a court order for today, but that did not prove possible either. And so we then drove back to Lahore this evening.
Why do you think that is?
I don't know. I think it's a matter of public record that restrictions have been placed on all visits for the last several weeks. I think family members, the legal team, and so on. Thankfully, he has had medical treatment at a hospital, apparently, in Islamabad. But as I said, we're concerned about exactly what he has, what investigations have been conducted, and whether he's had optimal treatment or not.
Can you tell me more about the last few visits you've seen him in jail? How was his health? How was his spirits? And how do you compare that Imran Khan to the one you've treated for 2 decades now?
Yes, I think whenever I've gone, I've always been struck, first of all, by how what good spirits he's in. He's always clearly pleased to see, to have visitors, obviously. We've known each other a long time, and I'm always struck also by the fact that when I'm there for a limited time, and I obviously want to get down to the nuts and bolts. How is he? So I can examine him and so on. But he always wants to hear about the hospitals, obviously, which are very close to his heart. The cancer hospital that he built in Lahore, and then the second one in Peshawar, where I work, in both of these hospitals. So his first several questions are always about the hospital. And whether fundraising is proceeding satisfactorily and so on.
Wow.
But he's always been in good health and in good spirits. I always mention when I come out that his resting heart rate is around 44 or so, which is, very good. And
that's a very impressive resting heart rate.
Yes, yeah, and it's reflective of the fact that he's exercised vigorously all his life and continues to do so even in prison. Wow. He does have an exercise bike of some kind, and he has weights. So he, as far as I say, until the last time I saw him, at least, he was exercising regularly and at quite a high level to maintain that kind of heart rate and a very good resting blood pressure. So he's generally always been in very good health whenever I've seen him.
when was the last time you saw him? Because it's good to hear that he has some exercise equipment to pass time as well as remain healthy.
Mm-hmm. I think you said, when did I last see him? I last saw him on the 2nd of November, 2024.
Okay, so it's been a couple of months. The other question I wanted to ask about was his wound from when he got shot, his leg wound. Has that improved? Is there other medical issues from that wound that need to be addressed?
Yeah. So again, that was something we always went over when I saw him. As you know, he had suffered several bullet injuries to his leg during a political rally in November 2022. The wounds healed relatively quickly and well, but there were some longer-term sequelae. He had a few metal fragments and pellets still embedded in various parts of the leg, which was not felt initially necessary to remove. 1 or 2 of them caused problems with localized pain, and they were removed later before he was imprisoned. But he continued to have a little, what we call neuralgic pain, so nerve root pain along the side of his foot, which was probably caused by some damage to one of the branches of the nerves supplying the left side of his foot. So that was troublesome, but didn't limit his activities in any way. When I used to see him in prison, he still had that residual discomfort in his foot, but as I say, it didn't seem to affect him overly.
How about food? Do you know what type of food? Have you asked him what type of food he eats? Is he being fed well? And more importantly, do you think, is there anything that may indicate intentions by the jail to cause medical harm? That's one of the concerns that a lot of people in this party have, that they're trying to get him sick. They're trying to have him be sick, to say the least, to kind of be less dramatic.
Yeah. Right. So, to be fair, I never saw any evidence of that. As I say, whenever I saw him, he was in good health. Pakistan is a hot tropical country. Everyone gets an upset stomach from time to time. I dare say hygiene conditions in prison food are not comparable to one's home, for instance. But over and above that, I don't think there were any instances where he had prolonged gastrointestinal or other symptoms that might be related to poor hygiene or to anything more sinister. His food needs are actually quite minimal. I mean, he eats well, but he's not too pushed about what he eats. He typically only has 2 meals a day, one of which is breakfast with nuts and seeds and yogurt and so on, and fruit. And his other main meal is in the evening. So I think he's really quite happy with whatever he eats. There was a story from many years ago that when he was living alone in Islamabad for some time, then he used to eat whatever the driver and the other domestic staff were eating because he couldn't be bothered to, go out or eat something more elaborate. So I don't think he's too pushed about the food, and he has some arrangement there, I think, where someone cooks food specifically for him.
What about I've heard about a tooth infection and later had an ear infection as well. Is that all healed?
Yeah, he had some problem with a ringing sound in his ears, which we call tinnitus. He had a little bit of that before he went into jail, and that was certainly aggravated for some time. That was probably, at least in part, because he's in a cell on his own. And in summer months, particularly when you have a fan or a cooler going in the room, then the constant sound of that can exacerbate that kind of symptom. That did get better with medication, and as the last time I saw him, that was no longer a major problem. But as I say, it's been over a year since have seen him, and I'm not completely up to date.
Oh, sorry, I made a mistake, doctor. Hold on, I made a mistake. You saw him in November 2024.
Correct, November 2024. 14 months.
My apologies. I completely got the date wrong. I got the years wrong. I thought it was November 2 months ago, and not November 2024.
Oh,
so
no.
Wow. Okay, so a lot could have changed since then, because I've heard that he's gone into solitary confinement.
Absolutely. Yes.
Conditions in jail have changed. You've gotten a lot worse. It's based on his sisters. Okay, that made the news that you've given us.
So as I say, what I'm telling you is from
back
a while
then.
ago.
A more political question, doctor. What do you seem like a very pragmatic person and very objective? What do you make of all this? I've spoken to all his sisters. I've spoken to his sons. I've even spoken to the prime minister just before he got arrested. For me, it just all sounds very heartbreaking. What is your take on it on a personal level, especially for someone that you've treated and known for 20 years?
Yeah, I've known him for over 30 years, actually, but he became a patient some years later. I mean, obviously, we're very concerned for him as a human being, as someone we know and is a friend in some ways. As a colleague, we've worked together in the hospital for a long time and in fundraising, and I've done a lot of fundraising work with him. He is a fundraiser par excellence. We're just, we're nothing compared to his ability to fundraise, but we've worked together on those areas too. So we are very concerned for him, is the fact that he has been incarcerated in this way, and that particularly now that he has health problems there. We hope and pray that he will be out as soon as possible. He's done a lot of good for this country, for the people of this country. He's established cancer hospitals where more than 75% of patients are treated completely free, consistently for more than 30 years now. He's established free universities. So he's done a lot of good. As you said, I'm not a politician. I am not able to comment on his political workings and so on. And I don't want to go into the details of why he's in prison, because I'm not really qualified to say. But on a human level, and in terms of all his charity work and the great deal of good he's done for this country, I would like to see him out of prison as soon as possible. I think a lot of people would, but I can't really get into the politics because I don't know anything about the politics, quite honestly. It's not my area of expertise.
Plus, it's to say the least, it's also very tricky to get into politics in Pakistan right now. At least that's my opinion. Last question, Doctor. Do you think he will come out? Do you think you'll be able to see him in the next 5 years?
Inshallah. Inshallah, we certainly hope so. I think there are a number of court cases and appeals and so on going on. He has an excellent legal team. We hope and pray for the best. As I say, he's done a lot of good, and I think he can still do a lot more good for this country. So we hope very much that he will come out very soon.
Doctor, really appreciate your time. Thank you so much, and I hope you get to see him soon.
Inshallah. Thank you very much.